Hi. After completing the Leadership Skills Questionnaire, I realized that I scored highly in the conceptual and interpersonal skills and lower on the administrative skills, which wasn't too surprising to me. In the past leadership roles I've had, I think some of the skills, the best skills that I had to put forth were communication and connecting with others. After reading Chapter 7, under the Directing and Supervising tabs, I I think the ones that I can relate to most are communication, um, allowing others to voice their concerns, making others feel respected, giving praise when deserved, and um, and being approachable. I think those were probably the skills that I related to the most, and I'm not sure that those skills, I don't know how successful I would be in a vertical organization. Some of the ones that I viewed online, some of the healthcare systems, a lot of them seem to have vertical structures. And with vertical organizations, there seems to be a little more red tape, uh, a little more frustration with decision making, and more of a hierarchy. I think with the skills I have, I would probably be more successful in a horizontal organization where there's more collaboration. Um, Generally speaking, there's a better morale amongst coworkers and staff, and I think there's probably more of an opportunity for everybody to voice their concerns and be heard versus a vertical type of structure. Um, how I would use my skills to solve a problem such as inadequate staffing are probably create an environment, maybe a structured time every week with my unit. I'm actually dealing with this situation right now. The floor I work on, we just merged with a larger unit, and we have not been staffed. We have not been adequately staffed since day one, and you know, I don't really know, you know, who's to blame exactly. It's a larger problem than just pointing the finger at one or two people, but the morale is really low, and there's a lot of negativity. Not to mention the patient safety is certainly an issue as well. So, going through this as we speak and kind of reflecting on this assignment, I realized that um, with the skills I have, how I might go forward with dealing with this is just, creating an environment where people feel they're heard. And that includes everybody, healthcare techs, nurses, the case managers on our floor, the secretaries, um, and maybe, having a structured, weekly 30-minute meeting where everybody could get together, or, whoever can get together and talk about what we can do, short-term goal, what short-term goals we can make to get to our ultimate goal, which is to have enough staff. That's kind of the easy solution, but kind of knowing how we're going to get there is is where the work lies. So maybe creating an environment where everybody can voice their concerns and feel heard, and then discussing like 2 or 3 things that we can do this week to achieve our goal. I think that's maybe how I would go about it if I were in more of a leadership role, because I think everybody wants to feel like we're working towards it. We're not just complaining and our manager hears us and nothing changes. We just want to know like action is being put forth with the problem. So maybe I think that's how I would approach it. The article I read that talked about transdisciplinary models of care was very interesting because it focused on dementia patients and Alzheimer's disease patients. As a lot of you know, that's a very progressive, complicated disease that can be difficult to diagnose and treat. And the article highlighted how using collaborating with all types of disciplines gives these types of patients the best outcomes they could possibly have for such a debilitating disease. And it's collaboration with doctors, nurse practitioners, social workers, health educators, registered nurses. I don't know if I already said that. So it was just so interesting to read this article about, it kind of focused in on a certain type of population and how they, found it to be very beneficial getting so many hands on deck, which is probably the point we're supposed to take away with learning about transdisciplinary models of care. I thought about how, I use that where I work, or, if I was in a leadership role, how I would, implement that. And I think, and obviously this isn't a new idea, and I've been on floors where we've done this, and I think it's very successful. But the first thing that came to mind was having a daily huddle, or maybe a twice a day huddle, that includes everybody from case managers, doctors, nurses, physical therapy, and we just take a few minutes to go over each patient's goals, their plan of care, how where we are with achieving that, and for some patients it might be getting them discharged. For others it might be getting them comfort care. So everybody's different, and utilizing all those different skills that the different disciplines have really kind of help that particular patient get to their appropriate outcome. So I think huddles are a great way to implement transdisciplinary care on a floor. And so the article is really interesting, and it made me think of the huddle idea. So overall, I think, kind of tying it back in, I think I tend to probably line up with and prefer the horizontal organization more so. I like to collaborate and feel equal with everybody I work with. I like to feel heard, and I like to make others feel comfortable and heard as well. I think probably one of the best skills I have is connecting and making relationships with people, and that's why I wanted to become a nurse in the first place. So naturally, having that skill with with employees, if I were in a leadership role, I think I would want to continue that on with my employees, wherever I was working. So but yeah, so that was a really neat assignment, and it had me think a lot about what type of leader I would be, and what types of skills I have. And I think there's probably other skills that I probably could improve upon to move into a leadership role. But I think communication and respecting others and making them feel heard is probably a good start, and hopefully will come into use sometime if I move into a leadership role. So, okay, thanks.